February is Heart Health Month, and there are many medications that can help you prevent or treat plaque buildup. Dr. Joseph Sutton, cardiologist with Christie Clinic, is here for today's Med Live. Thank you for being here.
Good morning.
What is plaque? Not on our teeth.
No, this is plaque in the arteries.
Yeah.
Plaque in the arteries grows actually under the intervessel lining. That's a misconception. A lot of us think that plaque grows like moss on a tree, but it actually grows under the intervessel lining. I have a cartoon here that shows plaque material growing up under the inner lining. The lumen of the vessel is actually this one cell thick layer. And as this plaque grows, it stretches this intervessel lining to the point where it just can't take it anymore. And plaque then pops, ruptures, and tears the vessel lining. And that's what causes the onset of chest pain or a heart attack. So the accumulation down here is really plaque is made up of cholesterol, LDL, bad cholesterol. And a lot of these little things here, we used to not really understand what they were because they became very engorged and bizarre looking. We used to refer to them as foam cells, but they're actually white blood cells, we now understand.
Okay.
And the white blood cells have acids and peroxides that can weaken this overlying cap and probably could contribute a little bit to the rupture and the onset of the chest pain.
Interesting. How can you prevent it from even building in the first place?
That's a good question. Plaque generally grows slowly over the first several years of our life until we get into our 40s or 50s, and then the accumulation is enough that the stretching of the inner lining is enough that plaque rupture then can happen. Aspirin doesn't help plaque from growing, but aspirin helps prevent clot from forming once a plaque is ruptured. Basically, there's two ways of avoiding or inhibiting or slowing the process. One is with diet, eating non-trans fats. You may have heard that's very popular.
Sure.
In fact, I think McDonald's now is bragging that they have no trans fats.
Right.
It's more than just the trans fats. So trans fats generally are animal fats. So low animal fat diet, vegetables, fruits are the way to avoid trans fats.
Sure.
But moreover, saturated fats. Coconut oil is not considered a trans fat, but yet it's very highly saturated, and so it promotes plaque growth more than other oils such as canola oil or corn oil and ideally olive oil.